On the computer desktop, double-click the simpleABI icon. When the program opens, select File, New ABI-Q Report. The report will open, and you can enter patient information, risk factors, symptoms, and ICD codes. Note, approximately 30% of patients with PAD symptoms, but a normal resting ABI diagnosis, will have an abnormal diagnosis after exercise. Your practice will improve the clinical diagnosis of patients with PAD by implementing a short exercise program in your vascular diagnostic testing. With the patient in the supine position, wrap 10 cm cuffs at each site 1 inch above the ankle. Attach the bladder portion first. Place the cuff under the ankle and wrap it around the ankle, holding it in place with one hand while wrapping it with the other. Be sure to follow the Velcro strip and wrap the cuff straight. When wrapping the cuffs, the patient may try to hold their leg up to help, but ask them not to, because when relaxed the cuff may loosen. Attach hoses from the Cuff-Link control unit to cuffs using the yellow hoses. The white connector goes to the patient's right side cuff and blue connector to the left. Have the patient exercise to increase blood flow to the extremities in one of the following ways. 1. Preferred, have the patient perform 50 dorsiflexions, raising the toes towards the shin and then relaxing while in the supine position. 2. Standing on the floor, while stabilizing on the back of a chair or the bed, have the patient perform 50 heel raises, or until exhaustion. 3. Hall walking may be performed for up to 5 minutes or until exhaustion. After exercise, have the patient quickly lie down, if standing or walking, and perform the exam as described in the on-screen exam document, testing the most symptomatic limb first. To obtain a PVR waveform, click on one of the boxes for taking a waveforms in the middle of the screen. On the remote top right, press the button with the waveform image on it. The cuff will inflate to about 85 mm and then slowly deflate to about 65 mm. Stop and hold while the waveform is obtained. Note, PVRs require patient cooperation. Limb motion affects the waveform. Patients should be instructed not to move or talk during this test. The waveform will start to appear after the cuff reaches 65 mm. If you are not satisfied with the waveform, simply push the waveform button again and a new waveform will replace the previous waveform. Press either next or back after the waveform is obtained to move to the other side. Repeat the waveform sequence for the other leg. Under each waveform will be the calculated ABI-Q. In the comments or interpretation field, document what exercise was performed and exercise duration. ABI-Q guidelines. ABI-Q greater than 1.00 indicates normal. ABI-Q between 0.90 and 0.99 indicates borderline risk of PAD. ABI-Q less than 0.90 indicates increased risk of PAD. When finished, save the report if desired as described in your user manual.